As a result of advances in healthcare and technology, this generation of elderly is slated for longer lifespans than previous generations. However, many of these later years may be spent with increasing disability and compromised quality of life due to chronic illness such as heart disease, cancer, stroke, and diabetes. Chronic conditions are responsible for 70% of all deaths, 1.7 million people, and 75% of healthcare costs each year. More than half of baby boomers ages 50 to 64 already report having a chronic condition, and nearly all 91% of adults aged 75 and older suffer from one or more. Just 4 health behaviors account for the majority of the risk for preventable chronic conditions: poor diet, physical inactivity, smoking, and alcohol misuse. Several factors might contribute to inadequate food consumption patterns in elderly, such as poor socioeconomic status, social isolation, physiological decline, age-related diseases, use of medication, functional limitations, and health illiteracy, all typical among older people.
Muitas vezes não é necessário ter dinheiro, é necessário ter imaginação.
A tremendous opportunity exists to engage millions of elderly in programs and initiatives that can reduce behavioral risk factors for chronic diseases and help them to maintain or improve their health and well-being. Our multidisciplinary team, composed by doctors, nutritionists, physical exercise experts, and engineers, developed an intervention tool that uses new information and communication technologies. We have developed an innovative interactive TV application with nutritional and physical exercise programs. In fact, a motivational and educational program composed with tips on nutrition, healthy and low-cost recipes, and physical exercise programs, brief reminders on health behaviors, and short questionnaires will be delivered during 3 months or 12 weeks. This motivational and educational program will be diffused to the intervention group by a TV application. The nutrition tips content are based on the book Alimentação Inteligente, Coma Melhor, Poupe Mais, a book published by the Portuguese Directorate General of Health on how to eat healthy on a low budget. The recipes were developed specifically for our program by Chef Justa Nobres with nutritionist and medical doctor consulting. Physical activity program was developed by physical exercise experts, and the main goal was to encourage physical exercise at home, at least 30 minutes, 3 times per week. The brief reminders will encourage the lifestyle changes. In fact, text messages are powerful in recalling and stimulating study participants to adhere. Interactive TV will also be used to collect data to evaluate the program compliance. With these short questionnaires, we aim to capture lifestyle changes and evaluate the learning along the intervention period.
Junte-se a nós nesta aventura. Participe!